7, identification of skin types. Regardless of the company that you choose, please recommend sunless tanning. Any skincare regime includes limiting time in the sun, but clients often want a tanned, healthy glow. Recommending sunless tanning products will make sure that you're pointing your clients out of the sun, but still giving them the color that they want. And suggest that you always recommend rapid products with a caramely color guide. These will give the client an instant glow, and they'll have a tan in a jiffy without any damage. When they see how easy and quick it is to get the color that they want from tanning, this might make sure that they stay out of the sun and don't get skin cancer. So this is great advice. Recommending these types of products does a great service to your clients. You might even be saving their life. The bottom line is that rapid sunless tanning are the products that tend to process very quickly into a lovely glowing tan within 1 to 4 hours. Also, make sure that you're recommending products that are of a very high quality so that your clients get the results that they desire, and that they contain eco-certified organic DHA, whenever possible. So how do you actually go about repairing DNA damage? Products and ingredients aimed at reviving DNA damaged collagen deficient skin or warding off the damage of UV rays hours after exposure while repairing DNA are amongst the newest skincare innovations backed by science. UV damage that triggers cellular mutations is to be avoided. These can result in precancerous lesions and skin cancer, so this is super important. This entire cancer growing process has been scientifically studied with the goal of formulating products with DNA repair enzymes. Our sponsor, Eliglow, reported in studies with 3 of its serums, it was documented that 91% of its participants said that their skin definitively appeared positively improved and different immediately. Additionally, 53% admitted that they had further improvement within 2 weeks. Participants stated many considerations, noting marked improvements across the board when asked about these specific areas. The vanishing look of fine lines, shrinking of deepening wrinkles, improved texture of their skin and thickness, increase in skin integrity, a decrease in grayness or dullness, progressive levels of skin hydration, and an evening out of blemishes and color correction of blotchy or ruddy areas. The question is, when to get screened? Always recommend that clients have an annual skin exam or screening, no matter what your client's risk is. An increased risk of cancer should have even more regular exams, more frequently, if and when recommended by a healthcare professional. Always remember that you're making suggestions. The choice to see their medical professional is always up to them, but you should make that suggestion. Suggest clients talk to their doctor about how often they should come in for a screening too. Depending on individual needs and risks, skin screenings could be more frequent than an annual checkup. The general rule for the Fitzpatrick type scale is the lower your number, the higher your risk, and the more vigilant you should be about screening and checkups. One of the most impactful ways to have clients understand how important regular screening is to make sure that the risk of melanoma and skin cancer are a bit more real. Skin cancer affects more people than you think. No one is immune to the risks of UV rays and overexposure to the sun. Here are some of the names that you can bring up of celebrities who've been affected by skin cancer at some point in their career. Let's make it real. Celebrities who've had skin cancer by Fitzpatrick category type 1 are Diane Keaton. She's very fair-skinned. At 21, she was diagnosed with squamous cell carcinoma on her face. She's a spokesperson for L'Oreal and has been very vocal about using sunscreen daily. Ewan McGregor has had multiple cancerous moles removed, and he stopped smoking and drinking alcohol, avoiding 2 habits that increase the risk of other cancers too. We would put Keaton and McGregor into category 1, which is very high risk for sun exposure damage. Now for category 2. Hugh Jackman is best known as the Wolverine in the X-Men franchise. It would easily be seen that he could fit into category 2. He looks fantastically healthy, but in 2013, he was diagnosed with basal cell carcinoma. Luckily, he caught this early and for the next 2 years had it and 4 other cancers removed from his skin. Now he gets a checkup every 3 months to ensure his skin remains healthy. Donald Logue, another category 2, is fair-skinned with reddish hair. He's best known for his roles in Son of Anarchy and Vikings. He noticed a bump on his scalp that turned out to be a squamous cell carcinoma. Melanie Griffith is also a category 2 and is a survivor of multiple cancer cases, one from her nose and another from a different part of her face. In category 3, Khloe Kardashian has become an extremely vocal sports person about the risks of skin cancer, even though people think she's healthy and somewhat of an olive skin, which would put her into category 3. She's had 2 moles removed from her back, one which was melanoma. Retired Olympic gold-winning decathlon and American television personality Caitlyn Jenner also had basal cell carcinoma removed from her nose. And in category 5 in 1981, Bob Marley died as a direct result of skin cancer that developed under his toenail, which was discovered too late. This should be a reminder to always check any unusual spots with your dermatologist. Actor Kerry Washington, in the documentary entitled In the Sun, said that she wanted to dispel myths about the dangers of UV radiation for people of color, specifically because they tend not to check for the disease until it's too late. I grew up in Africa, and this is extremely important. This disease accounts for 1 to 2% of all cancers in the Black population because people with darker skin don't think that cancer is a high risk for them. So they tend to find skin cancers much later than in lighter skinned people. We need to address this. What's most disconcerting for Black skincare clients that have melanoma is that they have a 67% estimated 5-year melanoma survival rate versus 92% for white. Think about that. Self-examination is the first line of defense in the war against skin cancer, as is education. People with an increased risk of skin cancer include those who have a suppressed immune system and a personal or family history of skin cancer. Regardless of their risk, it's critical for you to suggest that all of your clients talk to healthcare professionals and skincare doctors about how and when they should do their own self-examinations and skincare checkups. Skin self-examination is the first line of defense in the war against skin cancer, but it's not enough. That said, here are some suggestions that dermatologists recommend for cancer self-examination. First of all, use a full-length mirror and ideally get a partner to help examine areas that you can't see. Also, use a camera, a cell phone, or a handheld mirror to examine areas. You want to be able to document any progress in your skin and provide any photos of any changes to your healthcare professional at your checkups. The best way to see what's happening with your skin is to document it with photographs in a series over a period of years. If there's anything that concerns you or is on the following list, please seek out medical help from a professional immediately. When doing a self-examination, skincare professionals recommend that the person and their partner look for the following things: dark spots, growths, darker patches of skin that are growing, bleeding, or changing in any way. Any area where spots or growths are irregular, especially those that have changed recently. And make sure that you part your hair, look underneath your skin into any folds, and that means in detail, examining every single millimeter, every centimeter of your skin on your body. Check places that get little sun. Remember Bob Marley. Check the bottoms of your feet, toenails, lower legs, groin, buttocks, underneath folds of the skin, underneath your breasts, looking at your skin on your head, your neck, and your hands, and make sure to look inside your mouth too and examine your palms. Check for dark lines and underneath your fingernails. Performing monthly self-examinations is 100% ideal. Then you can find changes to the spots on your skin, which could be skin cancer. When these are treated early, treatment often gives a great prognosis. In the earlier stages, skin cancer can turn deadly and treatment can be difficult. But most often, if you catch it early, it will not be a death sentence. Sores that have a difficult time healing, especially if the sores are present on the skin that was injured in the past, or a patch of skin that feels rough or dry, are also target areas, as are dark lines or spots in or around the fingernail or toenail. Look at your skin again from head to toe, examining hard to see areas like the top of your head and your back by using a handheld mirror or asking a partner, ideally, to check these areas. Please be vigilant.